Health Science Technology 2 Dr. Wood. Blood. Health Science Technology 2. Dr. Wood. Functions of blood. Transportation. Heat regulation. Composition of blood made of plasma and formed elements. Plasma, fluid portion of blood. Formed elements. Red blood cells, erythrocytes. White blood cells, leukocytes. Platelets, thrombocytes. Hematocrit or packed cell volume, PCV. Percent of red blood cells in whole blood. Buffy coat, less than 1%, white blood cells and platelets. Erythrocytes, RBCs, mature RBC has no nucleus, ribosomes, mitochondria. Small biconcave discs. Primary component, hemoglobin, 1/3 of cell volume. Transport oxygen and carbon dioxide. Destruction of RBCs. Lifespan of RBC is about 105 to 120 days. Macrophages in lining of blood vessels in spleen and liver. Phagocytose old or damaged RBC. Erythrocytosis/polycythemia. Excess of red blood cells. Relative polycythemia, patient appears to have an excess of RBCs due to Absolute polycythemia. Primary polycythemia. Secondary polycythemia, stimulated by increased erythropoietin. Anemia. Number of RBCs or hemoglobin is low. Types: iron deficiency anemia, vitamin deficiency anemia, sickle cell anemia, hemolytic anemia. Iron deficiency anemia. Cells are microcytic and hyperchromic. Normocytic and normochromic, normal RBCs. Sickle cell anemia. Leukocytes, WBCs, 5 types. All have nuclei larger than RBCs. Granulocytes, have large granules in cytoplasm. Neutrophils. Eosinophils. Basophils. Agranulocytes. Lymphocytes. Monocytes. Neutrophils. About 65% of the total WBC count. Multilobed nucleus. Small light purple granules in cytoplasm. Function, cell defense by phagocytosis of microorganisms. Lifespan, hours to 3 days. Neutrophilia, increase in number of neutrophils. Often secondary to an acute bacterial infection. Neutropenia, abnormally low number of neutrophils resulting from decreased production, drug toxicity, virus, etc. Increased destruction. Pooling, overwhelming infections. Eosinophils, usually 2-lobed nucleus, large orange-red staining granules. Function, cellular defense, usually against parasites and involved in allergic reactions. Lifespan, 10 to 12 days. Eosinophilia, increased number of eosinophils. Allergies. Parasitic infection. Basophils, usually 2-lobed nucleus. Sparse, large purple staining granules. Least numerous WBC. Function, secrete heparin and histamine. Lifespan, hours to 3 days. Lymphocytes, smallest of WBC, about 25% of total WBC count. Large spherical nuclei with scant pale blue cytoplasm. Lifespan, days to years. Monocytes, largest of the WBC. Kidney bean-shaped nuclei with large quantities of blue-gray cytoplasm. Phagocytic cell capable of ingesting bacteria, debris, cancerous cells. In tissue called macrophages. Lifespan, months. Terms: lymphocytosis, lymphopenia or lymphocytopenia. Basophilia. Monocytosis. Monocytopenia. Platelets. Small, nearly colorless, irregular. Important in clotting. Platelet terms. Thrombocytopenia. Thrombocytosis. Blood types refers to the type of antigens present on RBC membrane. Important blood antigens: R, B, Rh. Agglutinins, antibodies dissolved in plasma that react with specific blood group antigens. ABO System Type A, antigen A on RBCs. Type B, antigen B on RBCs. Type AB, antigen A and B on RBCs. Type O, neither A nor B on RBCs. Plasma never contains AB against AG present on it on RBCs. Plasma does contain AB against those AG not present on its RBCs. The Rh system Rh positive, Rh antigen is present on RBCs. Rh negative, RBCs have no Rh antigen. Blood does not normally contain anti-Rh antibodies except through previous transfusion or pregnancy.